my name is Aletha Jones. I will be doing a health and physical for class N5326, Advanced Assessment for Nurse Educators, UT Arlington College of Nursing. Knock, knock.
Come in.
Hello, my name is Aletha. I'm one of the advanced nurses today, and the nurse kind of gave me a brief report of some of the things that you've been dealing with lately. So I'm going to sit down and talk to you for a little bit, and then I'm going to do a brief assessment so I can report what I get to the doctor, okay?
Okay.
Alrighty, I'm going to wash my hands. Okay, so first, can you tell me your name and date of birth?
Cheryl Armstrong.
Okay.
My date of birth is February 1st, 1975.
Okay. Now, Miss Armstrong, what brought you into the hospital today?
Well, I've been having this shortness of breath.
Okay.
A little weak,
Okay.
more than normal.
Okay.
And about 3 days ago, it started to get even worse. So I decided I needed to come in so I could see what's going on. I
Okay.
also have a little chest pain. It's not all the time,
Okay.
but I am having some chest pain.
Okay.
Sometimes, occasionally, I just get really confused.
Okay.
And I have no idea why.
Okay. Okay. Alrighty.
Also, I forgot to tell you also my stomach. I've been having some issues with my stomach. I've been having some abdominal pain.
Okay.
And I'm worried about, it looks like I have a little blood in my stool when I go to the restroom
Okay.
sometimes.
Okay. Now, are you only having blood in your stool, or are you having any blood in your urine?
Just in my stool.
Okay. Is there anything that you do that may aggravate this shortness of breath or this stomach discomfort?
No, it just comes and goes.
Comes and goes? Okay. And you say it's been going on for about 3 days now?
Yes.
Okay. Okay. Is there any medications you've tried to help with some of these symptoms?
Well, I'm trying to think. When my back was hurting, I was taking ibuprofen for that.
Okay, so you have back pain. What is the back pain related to? Can you tell me?
Actually, I had surgery, lumbar surgery, about 6 months ago.
Okay. And you take ibuprofen for that? And you've been taking ibuprofen since then?
Yes.
You remember how much you're taking?
About 800 milligrams.
Okay.
And I'm taking about every 8 hours. I only take it when my back is hurting.
Excuse me. Sorry about that. Okay, so you're only taking it when your back is bothering you, and you're taking ibuprofen 800 milligrams every 8 hours as needed.
Yes.
Okay. Is that the only medication that you're taking?
Yes.
Okay. All right, now I'm just going to ask you some brief history questions, okay? So you've had lumbar surgery. Is there any other surgeries? Outside of this surgery, have you ever been hospitalized for anything else?
No, that's the only thing that
Okay.
I've had. Yes, that's the only time I've had.
Okay. So outside of back issues, do you have any other health issues?
No, just nausea, vomit,
Okay.
abdominal pain.
Okay. I'm asking you about family health history,
Okay.
and this is in regards to your mother, your father, sisters, and brothers, okay? Anybody have a history of cancer?
No,
Okay. How about diabetes?
no.
Okay. So when you said the weakness and stuff has been kind of increasing, the fatigue and stuff, are you having any dizziness?
Occasionally I do.
Okay.
It's not every day, but occasionally.
Okay. How is your appetite been?
Well, sometimes I'm hungry, sometimes I'm not very hungry.
Okay.
I think because usually I'm afraid because of my stomach.
So when you eat, does that sometimes make it hurt it, or when you eat, what does that do to your stomach?
Well, sometimes it hurts when I eat, and sometimes it hurts when I haven't eaten.
Okay, okay. So it's not really dependent on what you're eating. Okay. And your diet is just pretty general. What do you, just whatever you like to eat?
Just
Okay.
regular.
Okay, so emotionally, how have you been feeling lately?
Just afraid sometimes to eat certain foods because I'm afraid that my abdominal pain is going to get worse.
Okay. Do you have any history of, have you been treated for any mental illness, depression, thoughts of suicide, or anything like that? Okay. All right, there's something I want you to do for me. Can you tell me where you are?
I'm here in the hospital.
Okay. And do you know what month and year it is?
This is May 2015.
Okay. And do you know who your president is?
Yes, President Barack Obama.
Okay. I want you to remember these 3 words for me, and later I'm going to ask you to repeat these words for me. Okay? Apples, bananas, and oranges.
Okay.
Okay? Now remember those words for me. Okay? Alrighty. Let me see. You said you've had some dizziness, some weakness. Have you had any fainting spells?
No.
No fainting spells. Okay. When was your last menstrual period?
About, it's really a little irregular.
Okay.
So it's been about 2 months ago.
Okay. And do you have children?
Yes, I have one son.
Okay. How many pregnancies have you had? One. And you carried that one son greater than 20 weeks?
Yes.
Okay. Okay. Do you by chance smoke?
Yes. Usually about 1 pack a day.
Okay. How long have you been smoking?
About 10 years.
10 years? Okay. Do you drink any form of alcoholic beverages?
No, I don't drink any alcohol, but I drink some wine every day.
Okay. And do you use any type of street drugs or illicit drugs?
Oh, no.
Okay. All right. Let's see what I'm going to ask you. When was the last time you had a history of physical by your primary care physician?
About 2 years ago.
Okay. And are you married or single right now?
I'm married.
Married. You live with your spouse.
Yes.
Alrighty. Can you tell me those 3 words I told you earlier?
Apple, banana, and oranges.
Alright, good, good, good. Okay, I think that's pretty much all the questions I have for now. Tell me about your diet. How often do you have bowel movements?
Once a day.
Okay. And when did you start noticing the signs of blood in your stool?
About a week ago.
A week ago, okay. And before coming here today, have you been to anyone else to be seen about this problem?
No.
No? Okay. Okay, so you were talking about, you've been short of breath. Have you had a cough?
Some occasionally.
Have you produced anything?
No.
So it's been
just
dry?
a dry hacking.
Hacking, okay. Have you been to any? Have you ever been diagnosed or told that you were susceptible to being sensitive to TB, or have you been to any countries outside the U.S. in the last 30 days?
No.
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 Okay. Have you ever had a TB screen?
Yes.
Okay. Have they came back positive or negative?
Negative.
Negative. Okay. Good. Good. Alrighty. And immunizations. Have you had your yearly flu and pneumonia
Yes.
shots? Okay. And have you had a tetanus shot in the last 10 years?
Yes.
Okay. Okay, now I am actually going to move to the physical assessment part, okay? I am going to have to touch you, okay? So if you feel uncomfortable, or I'll explain everything I'm doing. If you have any questions, just let me know, okay? So do you work?
Yes, I do.
Okay, what kind of work do you do?
I'm a daycare worker.
Oh, okay, okay. Oh, well, that's a busy job.
Yes, a lot of little ones.
All right, I'm going to listen to your heart and lungs real quick, okay?
Okay.
Take a deep breath in and out. And I'm going to reach around on the sides and listen to your lungs on your sides, okay?
Okay.
Okay, your lungs sound very clear. I didn't hear anything abnormal. Your heart is strong, steady beats. I didn't hear any abnormal sounds or anything like that, okay? Now what I'm going to do is I am going to feel what we call the point of maximal intent, where the heart beats the strongest at. And I just want to assess that area real quick, okay? Okay. Now I'm going to move to your stomach. I want to look at your tummy, and then I'm going to listen to it. And I am going to feel, first it's going to be a little light, and then it's going to be a little deep. I'm just trying to check and see if there's any tenderness in the areas, and if I feel any enlarged organs, okay?
Okay.
All right. First I'm going to listen to you. There we go. Okay, they're a little hyperactive, but I would kind of expect that with some of the discomfort that you're having. Okay. I'm just going to lay you down a little bit so I can get a better assessment while I'm feeling. ultrasound. And you tell me if there's any tenderness. Does it hurt right there?
Just
Okay. I'm sorry. So really right in these areas.
Yes.
Okay. Your pulses are strong and pretty equal. Sometimes when you are kind of weak, your heart rate has been a little up for the simple fact that, you know, your blood pressure is a little low right now.
okay.
Your heart rate's a little up, so sometimes your heart is trying to compensate for that low pressure, okay? So that's part of the reason why you've been probably a little weak, lightheaded, more than usual, and dizzy. Okay, with the, I'm kind of concerned with the ibuprofen and the bleeding because that could probably have irritated your stomach a little bit too.
Oh,
Okay. Now what I'm going to do is I'm going to sit you up and I'm going to have you sit up on the side of the bed because I want to check some areas in your back. Okay, I want to check some areas in your kidneys to make sure you're not having any pain that's being stimulated from there as well. Okay? So I'm going to make sure we got you right down close to the ground. And I'll have you sit on the side of the bed. So make sure you don't have any swelling. You haven't had any rashes or anything like that, have you? Skin rashes? Okay. And so you had a lumbar surgery about 6 months ago. Have you, lost my train of thought. Did you have any blood transfusions during that time?
No.
Have you ever had a blood transfusion? Okay. With your blood pressure being so low, the heart rate being slightly high, I am kind of worried that your volume depleted a little bit. You haven't been eating or drinking a whole lot either, and then with the bleeding. So there is a possibility, more than likely the provider is going to want to type and cross where we draw blood to match you with screen blood, okay? So you may be getting some of that. The nurse will be starting an IV and getting some fluids going as well, okay? So we're going to try to get you to feel a little bit better, but having low volumes is going to cause you to feel a little confused, dizzy, lightheaded, and things like that.
So you're saying I'm gonna have a transfusion?
Well, I'm gonna talk to the doctor first and see what he wants to do.
Okay.
However, and we'll probably do some stool samples as well to see if it's positive for blood. We'll probably start with the fluids first, try to get your pressures up.
Okay.
And then we'll draw some labs. We're gonna draw some labs. And he'll base his decision off of what your hemoglobin and hematocrit levels are.
Okay.
And that's what we use to test to determine whether someone needs blood emergently or we can probably try to watch them and use other measures. Okay?
Okay.
Okay?
Okay.
All right. I'm going to have you sit on the side of the bed for me. There you go. And I'm going to come around to the back, okay?
All right.
All right. I just want you to breathe in and out as normal. Okay. Does that hurt?
Just a little.
Just a little bit. Okay. All right. Now, can you say 99 for me?
99.
Say it again for me.
99.
Okay.
99.
Okay. Okay. You can lay back now.
Okay.
All right, Miss Armstrong. For the most part, I think I have completed everything I need to do, and I've gotten all the data that I need for the doctor. Do you have any particular questions for me?
No, I can't think of any right now.
Okay. Okay. Well, if you have any questions, you have your call light. Make sure you cut the call light on. The nurse will come. If you have any questions that she cannot answer, she'll come and get me. Okay.
Okay.
Nice meeting you,
Nice
and
meeting
I
you.
hope you get to feeling better soon.
Thank you so much.
You're welcome.
Have a good day.
You too.